we like you very much to tell us whether you've got something you'd like to say. And I usually give a brief update on where I see things are at the moment. And then I stop and I invite all of you to make comments. By sending us a note on the chat, we're able to see what you might like to talk about. And then I will arrange that as much as possible, you'll all be able to be involved and we will have what will be, I believe, a pretty interesting conversation. We've also tried to do a little visual illustration of what happens. And Jack is here and is doing the illustration. Periodically, we will actually open up Jack's screen so that you can see it. At the end of the session, we will post a recording of this event and also the visual image, visual record, and you can then take that and use it. And I know that some of you are finding these visual records to be really helpful. I do, I have a great collection of them, and I want to thank Jack and team on behalf of all of us for what they're doing. So the chat line is open. Colleagues will be inviting you to share. And now I just want to give you just some top line statistics on what's happening. The World Health Organization keeps a record of the number of people who are reported as having been positive with COVID-19 around the world. And currently, we've got a figure, I think you know about this, of over 35 million around the world, including the President of the United States. And we also have figures on the total number of people who died of COVID, reportedly certainly over 1 million. Now, our colleagues in WHO are saying, everybody, this is a huge underestimate. And I'm sure that all of you know people who've had the symptoms of COVID, who've not been tested, who pretty certainly have got it. So during the last couple of days, Mike Ryan, the head of the emergencies program at WHO, was asked, how many people have had COVID? And the other part of the question was a little bit one attached to it, which is, have enough people had COVID in the world that we can actually start to say that there is some degree of herd immunity, i.e. that enough people have had the disease that we're beginning to get to a point where there is broad immunity in the population. And that means that the risk of disease is perhaps decreasing because the numbers of who are ready to be infected is also decreasing. Mike Ryan said the following. He said, in my view, yes, there's an underestimate, but also he said, I don't think that more than 10% of the world's population have actually been caught by this virus. Now, 10% of the world's population is 700 million. And that's an awful lot more. That's 20 times more than the current total number recorded by WHO. But it's not an unreasonable hypothesis. But just look at that, 10%, 700 million, but there are still 90% of the world's population who are susceptible. So if anybody says to you, I think we're reaching the point where there is herd immunity, I think we can let go and we can let anybody get the virus and not worry too much because sooner there will be enough people in the world infected and then we can all get on with our lives. Anybody who says that, just say, hang on a bit, are you sure? Because I don't think we're at that point. And that's why I want to say to everybody, I think the world still has to do everything possible to defend against the virus, to stop it from catching us, to be frightened of it. Yes, please be frightened and try to make sure that we don't get infected and that others don't get infected if at all possible. And that's because this is a dangerous virus. And that's because there's still 90% of the world's population who are susceptible. I'm going to go on saying to people that I want them to be afraid of this virus. This virus has caused 1 million people to lose their lives who shouldn't have died. This virus who's causing a lot of the people who get the disease to be ill for a long time. It's between 1 in 20 and 1 in 50, according to the figures that I've been able to get hold this week, are affected by long-tailed COVID. Long-tailed COVID is associated with fatigue, it's associated with shortness of breath, it's associated with cardiovascular problems, it's associated with clots that lead to emboli in the lungs. Long-tail COVID is something we're learning about all the time, and it's serious. So I'm saying to everybody, please don't treat this virus lightly. And you know why I'm saying this. You know why I'm saying it. Because there's a group of people who are putting it around that we don't have to be afraid of this virus. We just have to be strong and muscular and tell the virus that we don't want to be touched by it and somehow it will go away. They're presenting it as being something that we can actually fight against through willpower. I don't think that's right. I think as far as I can tell, this virus can get anyone. Anyone can be caught by it, whether they are mentally or physically strong or less strong. And we need to remember that, and we need to keep that as part of the discourse. I really, really don't want people to let down their guard. I want us to hold this virus at bay. So together with our colleagues, and those of you who've been with us a few times know that this is an undercurrent, we continue to ask governments everywhere to actually make sure that there are consistent and clear messages going to their people. It's not lockdown. I do not believe that lockdown has a role in keeping on top of this virus unless things are really bad. Either bad in terms of we're disorganized or bad in terms of the amount of damage being caused by the virus. Then, okay, lockdown for a bit, keep it as short as possible, protect those who are most affected. But that's not the basic way to deal with this. The basic way to deal with this is to hold it at bay through society-wide defences that stop it from welling up. A bit like water. When you've got floods and you've put all sorts of sandbags at your door to try to keep the floods away, if you keep any little gap anywhere, or if the drains are open, then the water can well up, often very smelly and nasty, and cause all sorts of problems. It's that welling up of the virus and catching us unawares that we want to stop. And that's why we're so keen on having the ability to detect people with the disease, to isolate them promptly, really quickly, before they've got their symptoms, and then to keep them isolated, properly isolated for the full 14-day period, to trace their contacts rigorously and to make sure they are isolated, and isolate them for long enough to check that they don't have the disease. And meanwhile, protect those who are vulnerable, over 65 and people with other diseases, to make sure that they are kept as safe as possible. And to help all this to happen, we do everything possible to stop the virus from catching us. And that means maintaining physical distance, wearing face protection, practicing really good hygiene, isolating ourselves if we think there's any possibility that we might have the virus, and again, protecting those who are vulnerable and looking after those whose living conditions or working conditions put them at risk. That's the kind of behaviour that we want to see as the role model behaviour. And we particularly want to see national leaders displaying this role model behavior. Because if the leaders show it and do it regularly and rigorously, then the people feel that they have some example to follow. But if the leaders do not do what their people are being encouraged to do, then we have a problem. We have inconsistency, and we have people who should be acting as role models not doing so. I'm actually really pleased that in the last 24 hours, at a special session of the World Health Organization's Executive Board, we have seen national delegations very clearly congratulating and encouraging the WHO Director General to continue with his consistent positioning on what is role model behavior in dealing with this virus. I'm delighted that we continue to really call out and praise the governments and people who are doing it right. And just if you want to know who I think are doing it right, I will go on giving you the same names. Yeah, China, Taiwan, Vietnam, Cambodia, Thailand, South Korea, Japan, and other countries in East Asia, New Zealand, Australia working really hard, and I think they're getting it right. Malaysia, very promising. Senegal, Morocco, South Africa, Kenya, trying very hard. Many countries in Latin America, not all of them. Many countries in Eastern Europe, some countries in Western Europe. But the countries that are not getting it right are the countries where communication is inconsistent. The countries where governments are somehow caught up in the narrative that it is either the economy or public health, and they appear to be making really quite bungled choices. That's not the way to do it. It's sort out the public health and then your economy can be got right. But don't present it as a choice, because it's not. We're at the moment in quite a tricky phase. I've been looking at the figures for where the virus is. If you can see my graph, if you look at the top of the yellow, it's beginning to pick up again, pick up quite fast. And that's what we're seeing. We're seeing an acceleration in cases each week. And this is very much reflecting an acceleration that is taking place in Europe. There is quite a marked acceleration of COVID in Europe right now. This is because of three reasons. One is that there's been a lot more movement of people in Europe in the last 2 months, particularly as a result of a combination of vacations, young adults going to university, and children going back to schools. And this was after quite a long period when movement in Europe was restricted. Now, that movement in itself wouldn't have to be a problem. But the second challenge is inconsistency in Europe on messaging about the actions that people should take. And that's led to quite large communities of people deciding that they do not want to practice physical distancing and face protection. And understandably, because they're getting mixed messages from their leaders. So there is a problem because of inconsistency. And thirdly, there's a challenge because in some Western European countries, the process of finding people with the disease through testing is not working as well as it should. It's inconsistent. And so there are numbers that are going up, and probably that's an underestimate of what's really happening. So this virus is certainly beginning to start spreading again in Europe. And what we're encouraging is that there is local level action by different groups in localities, led by, wherever possible, the local public health actors, but with full involvement of local religious groups and businesses, as well as the local authorities and any community organisations, so that the COVID is dealt with by the local communities, so that Europe can go down the same path as East Asia without having to do massive extra hard regulations from the top of government. Because it is our view that if you try to encourage behaviour change just through more and more regulations, you have to turn the screw tighter and tighter and tighter. Whereas the only changes that really mean something will be those that people make because they wish to make them, because they feel they're the right changes to make, because their peers are encouraging them to make them, and that's because they choose to do it. And so that's why I come back to role models and trust, because without strong and powerful role models helping people to know what it is they ought to be doing, they will get confused. And if they get confused, then this will lead to some frustration with the requests being made of them. And it's very hard to rebuild trust once trust has broken. And many of us have focused on that. So that's my opening remarks. And I'd just like to go back to Twee now for a quick update on who we are and where we are. I'm very keen to hear from all of you on your experiences of role modeling and of trust and what we can do to encourage it. I'm very keen to know whether you feel that it's time for us to be talking to business leaders, government leaders and others about creating a much stronger and more public encouragement of good behaviour and encouragement of role modelling. Just let us know and let us build out of this to continue our working together on these issues. Let's go to Twee.
Thank you. And while I share the results, I'll invite Jack Brown, our illustrator today, to share his screen so you can catch up to what he's drawn so far. Where you're joining from, we have great attendance, in particular from Latin America and North America. So for the time that we're holding these sessions, great to see people joining from that part of the world. In age range, a very nice spread across all ranges today. And then in how we're feeling today, as usual, optimism and hopefulness is the greatest, which is always good to see. Also do see some people selecting some of the more negative emotions there: discouraged, doubt, worry, blame. And I'll just take this opportunity to let you know that we do have our private community chat group on LinkedIn. I put my link in the chat box there. So if you want to join that group, please send me a message and keep the conversation going there in between these briefings. Thank you.
Very good. Oh, lovely, lovely. Jack, thank you for showing us the screen. And please, we'll try and ask you before the end to help us. There are some people who are new to the briefings on this. I'm going to give a special moment to one or two people. Let's hope it works. I am very pleased that Cecilia is here, but I can't see her. I can't see her on the screen. Kath. Okay, you're looking for her. Cecilia, if you're here, do unmute yourself and let us know. It may be you've slipped off. This is, if it is Cecilia, and if it's Cecilia, I think it is, she's part of a very important group in Washington called the National Academy of Sciences. And I worked with them and have worked with Cecilia on quite a lot of issues. And so if she comes back, Catherine, please tell me. Thank you. I want to give a very special welcome to Sarah Cherubin from UNEP Nairobi in Kenya. Sarah, I can see you. I hope you're well. If you want to speak, that would be great. I also want to give a special welcome to Meredith Fort, who's Assistant Professor of the Colorado School of Public Health in the Department of Health Systems. Meredith, I can see your picture there. And again, if you want to say a word, please unmute. And if you like, show us your video. That's a good way of catching my attention. I'd like to go first to Maurizio Calderon. Maurizio, would you like to reflect on any of these points that I mentioned? And if you want to bring up what you shared with me this week, that would be very nice as well. Maurizio, over to you.
Thank you very much, David. As usual, very delighted to be here. On what I shared with you last week, we spoke a bit about the need for there to be availability or better availability of equitable distribution of tests to confirm the COVID infection. And we seem to be having good news in that regard, because there are now several alternatives to low-cost, widely available PCR tests. And basically, I shared the news that was published from India, where a paper strip based PCR test is being designed and will be produced apparently in very large scale, and with the intention of becoming a point of test, or point of service test, I should say, point of care test, in any primary care setting, and even in other places in the communities, at home, etc. And it comes with a very reduced cost. It's about £5, 500 rupees, more or less, which is a significant reduction, because the previous PCR tests in India with the same cost references was 5 times that much. So obviously it's a very significant cost reduction. And obviously now the challenges of producing to scale and setting up the distribution networks and the logistics to cover hundreds of millions of tests are there. So it will be a very interesting thing to see how in India I don't know if you lost me.
No, you did, but it's come back now. But Maurizio, this is great. This is the Faluda test, everybody.
The Faluda test, yes.
UDA. Maurizio picked it up. It was reported in the BBC. And we're in a very, because this one, which came from the and integrated biology in New Delhi and has gone to Tata for production and manufacturing, is really exciting. And we've got 2 or 3 others that have just become available. This is so wonderful. It's transformative. The one really big problem we face all over the world is the difficulty with enabling people to know whether they've got the virus, enabling societies to know the viruses. These new quick tests are marvelous. The Faluda has an extraordinary reliability score, 98%, I think it is, Maurizio, 98% sensitivity.
Sensitivity, yeah.
That's right, and 96% sensitivity. It's very good. You only got 4% false negatives. And so, and we all know that this is a tricky one always to measure, because some people have got very light viral loads, other people have got very heavy viral loads. It's 100% sensitive. I think, Maurizio, this is wonderful news, and I thank you so much for drawing it to our attention. Be transformative. Thank you, Maurizio. Let me go if I can find you to Meredith. are you here? Meredith Fort, if you could unmute. I saw you unmuted just now, and yeah, here you are. Hello and welcome. Thank you for joining from Colorado, if that's where you are. Tell us how you see things, particularly on the issues we're discussing today. Over to you.
Thank you for the opportunity to join. This is my first time. I am based at the Colorado School of Public Health, but am tuning in from home, which I think is the case for many people. I think from what I have been seeing, it's a challenging time. I did respond with a combination of optimism and frustration, which is very much how I have been feeling. I think what I have feel that is really important is to prioritize public health, and I feel that is not highlighted enough in a lot of the the media and coverage that we have in this part of the world. So I liked your opening comments in talking about the importance of having local leadership and role modeling, because I think at this point that's what I feel is where our potential is moving forward.
And very well understood, Meredith, when you make that point. Local leadership, local role modeling is so important. We're seeing it all over the world. Just about every single one of the places where COVID is spiking, we can come across local leaders, not necessarily political leaders, but also religious leaders and sports leaders and community actors, fabulous business leadership as well in some cases, that's helping to offer role models to people. Thank you, Meredith, for what you're doing. Thank you for joining us today. And I'm going to go on inviting everybody to give these quite short comments on what they're seeing where they are. I just like Sandrine, I know this is the first time you've joined and you may well not want to talk, but if you do, if you just unmute and just wave at me, I'll bring you in. It's and there's no pressure. Now,
Hi.
Come in, Sandrine.
Hi.
Tell everybody where you're from.
Hi, everyone. I'm from Brazil. I'm currently in São Paulo. And, well, I work with local governments. I work at ICLE. And I know that these issues are really urgent for all of us. But things here in Brazil have been extremely hard. Our economy has been really pressured from this COVID-19 situation. And I think these are very interesting subjects to think about, leadership and who's taking power now. So yeah, nice to engage with you all. Thanks for the opportunity.
When I spoke to Sandrine earlier today, she made the following point to me. She said the really awful pain for her and other young people like her in Sao Paulo state is that COVID has so damaged the economy that the opportunities for employment for her and others in her group are really much, much less, perhaps a 30 or 40% reduction in job openings compared with what they were in previous years. We hope it's a temporary shock and that things will get better. But the reality is that in Brazil, the economy has taken a huge hit. Now, we know from the work that we've been doing in these briefings and right across my group in 4SD and right through the whole WHO team, we know that a country does not have to have complete economic collapse because of COVID. If you put the right priorities in place, if you get local action to be able to get on top of the disease, to hold back the virus, then the country can continue. Yes, there'll be some economic hit, but it won't be this huge loss that we're seeing in Brazil and in other countries that have got big COVID outbreaks. I think that we need to come together in solidarity, in support of the countries where things are not going well, through all the connections we have, to keep reminding those, particularly those working at local level, that if you sort out the public health, as Meredith said, now I want to stress it's the public health, and that is the capacity to find people with disease and to isolate them, to trace their contacts and to isolate them as well. You can sort that out, then the economy can continue, because as soon as little spikes build up, you suppress them. And that's what they're doing in Vietnam, in Thailand, in South Korea. We know that. And it could be possible in other countries as well. And it's never too late to start this strategy, never too late. We've seen that in many European countries, like Northern Italy, where they've done really well to re-establish the capacity. So we'll stick with you, Sandrine. Thank you for joining us, and thank you for sharing. Let's now go to Annie, and then we'll go to Georgina. And then if that works, then we'll come to others on the list. But Annie first. Annie Felton, you have the floor.
Thanks, David. I'm very struck what we said last time when you were talking about the global north not doing very well. And it seems to me that that's a very systemic issue. You know, what I'm thinking, there's no silver bullet there. And in the UK, we've got we have ramshackle government behaviours, and most of the time we can cope with it. But clearly, with the virus, that gives us a lot more problems. My last comment is this, which I think is really weird. Where I live in the east of England, the virus rate is approximately, you know, let's assume it's always an underestimate, 18 to 100 in 100,000. And then up in the big city of Manchester, it's 525 per 100,000. And we haven't got an explanation of that huge slippage and that variation. And so that I find that it's appalling if you're in Manchester, but I really want to understand, because I don't believe we're doing much better here. Is it luck? It isn't, you know, I hope most of us are being sensible, but that enormous variation is such a surprise to me. Thanks, David.
Thank you very much, Annie. I would just start with the hypothesis this is to do with the frequency of contacts that people have. You don't need to reduce contacts very, very much to greatly reduce the incidence of COVID. We've seen that in so many locations. That's why cities tend to have more virus and higher rates. But I would also say that there may be other factors in Manchester. For example, it may be much harder for people to practice physical distancing at work or at home. There may be cultural or economic or political factors even that make it difficult. Let's keep that hypothesis open. Why have we got such different levels of infection in Essex versus Manchester? Good point. I look forward to seeing more comments on that. Let's go to Georgina. There's a particular issue that you've picked up, Georgina, on the testing, which I personally think is worth focusing on. Where are you, Georgina?
I'm here. Can you hear me?
Yes, of course, very clearly. Where are you coming in from?
Winnipeg, Canada.
Winnipeg. Tell us what the situation is as you see it in Winnipeg. Over to you.
We should not fear it. Life goes on. The economy is important. And that nationally, there's a shortage of chemical agents to do the testing.
Yeah.
Is this true?
Yes, there is a world shortage of 2 of the key chemicals that are needed for PCR testing. Yeah, not everybody is suffering from it, but it does mean that for some, it's proving difficult to get adequate materials to do PCR. It's particularly the case for certain platforms that are used, what we call the kit platform. Some of them, I won't mention the name, are really finding it difficult getting their supplies. So, yep, there are problems. And in my judgment, particularly at this phase that you're in Canada, Georgina, you really do need the testing. You need to know where the virus is. And we do know from talking to colleagues in Montreal that it's been very difficult. What's the situation in Winnipeg? Are your numbers rising? At least the numbers that you are able to look at from the testing that's being done? Or
It's
are
the
you?
schools. It's the schools, basically.
Yeah.
Yeah.
Ages,
But we're doing okay.
all ages or older kids?
All ages.
Yeah.
Yeah.
Well, that's important to know, and that must be creating major challenges for parents who will be feeling nervous about their children at school. Also, it'll be really difficult for the school headmasters who, according to my information, find these situations very difficult. Thank you very much indeed. Sarah Phillips, if you're there, I can see you now. You've got something, a perspective on role modelling. You yourself have been a role model for others, and you were talking about your own village in a previous briefing. Give us your perspective, please.
I worked in a large London hospital, and years ago we brought in hand gel, and it was, people thought we didn't need it, and there were some consultants that, well, we don't need that nonsense, and who are these people telling us what to do, and all that stuff. And we just found, brought it in with infection prevention. I was doing veins and things at the time and as well, and it all fitted. But once we got the sort of what you call laggards moving over, and then people spotted that, the med students would follow, the healthcare assistants, the cleaners would. So it just really helped. But also, you know, not to say that seniors have to lead it all or whatever, but it did make a difference. Yeah, and I just think that bringing in that change in role modelling, and just constantly, I couldn't walk past a hand gel if I'd, especially with my matron outfit on, it was just not on, because if somebody had spotted me, it would affect them. So yeah, my hands kind of wore out a little bit.
If 20% change, then the other 80% will change pretty quickly afterwards. In hospitals, if the bosses don't do it, it's very hard to get the rest to do it. When I was doing surgery, I used to get super frustrated if I saw the surgical leaders cutting corners on sterility when they were gowning up or during their operations. I used to get frustrated if I saw corners being cut on cleaning when wounds were being dressed. I think that this role modeling in public health is so important for all of us. Not perfect, mind you, but anyway, just saying that. Louisa, you were going to come to draw on this and talk about role modeling more widely. Louisa, you're in UK, but you might want to not talk from the UK perspective, your choice.
I can actually only talk from the UK perspective. That's where I have been for all of this pandemic. No, I think we are, not to forget that we are all role models in our everyday lives, going on public transport, wearing a mask, going into a shop, sanitizing our hands and wearing a mask. Because the more we do it, the more people will follow just the same. So it's, yes, we are looking to our community leaders and country leaders, but we also we're looking at each other more than anything else. So don't forget, don't let it slide.
I hope everybody's got their mask in their pocket. I've just bought a new one because my last one was too dirty. I like it. So I think these are important, and everything you're saying is absolutely vital on this. I'd like just now to go and actually bring in one or two of you to just focus on this. Now, Holly Wheeler, you have been helping us to think about ways in which we can actually give positive encouragement to the people who are really making a difference. And you would like us to find ways to shout out more effectively to them. Vicky Doyle, you with Nazim have been using music to help identify and praise good behavior. I'd like, if anybody else who's got any suggestions from where they're working to help us with this, just to give us very short vignettes. Let's start with Holly.
Hey everybody, good to see you all. Thanks, David.
So this morning I was having a conversation with one of the hospital trusts, and she is leading a comms group across the whole region in the UK. And what we were talking about was, how do we support people for doing their bit? So we're developing there's a hashtag called Your Bit, and they're trying to work out how they spread that as a way of saying, sort of, do your bit, and how you turn it into something about, I've done my bit, you know, our bit, and showcasing that so that people can see what active, positive actions they can take. So simple things like isolating when you're not feeling well or when you've been contacted, but they're extending it into things like getting flu vaccinations or making your workplace COVID safe. So those kinds of things. So that's a very practical application of it, and just trying to give a visual thing and encouraging all their leaders to talk about the positive stories of people doing things well.
Brilliant. I want to really give a shout out to the WHO team, who Tedros and others, who are talking about doing it all. They're very keen to stress that it's not just one or two things, token things, but you've got to do everything. You've got to do the hand washing and the face masks and the physical distancing and the self-isolation. Just doing one or two parts of it isn't enough. Marianne, I'd like you to come in and talk a little bit about what you're seeing in Uganda before I go to Vicky. Marianne, please.
If I can just speak very quickly. I was having a conversation with the chairman of my organization at the weekend, and when he was talking, because I said, you know, about it being such a young population, and that's why they seem to have very low incidence of COVID. But he said that's part of it, but the other part of it is the way that the poor people in Uganda tend to live in the rural areas more than in the towns and cities. So consequently, they physical distance through everything they're doing. And it seemed that an interesting comment coming from him. He is a medical doctor and a public health specialist. So it was a surprise to hear him saying it, that it's not just the young populations. Just to add on about being young populations, when you get in my age group, it seems that for the foreseeable future, I'm not going to be going very far, because over 65. Well, that was a very long time ago. So it is something to think about, and how we survive. Thank you.
So just to Marianne, in my judgment, the most powerful way to stop numbers rising is for people to not get close to each other, particularly in confined areas. And I've been reading of reports from South Africa. I've been reading reports from other parts of Africa showing these amazing declines. And I don't think they're artifacts. I think they are because people are really taking these issues super seriously, and they're just incorporating it into their normal behavior. After all, as I've said before, this is what is actually quite commonly practiced in communities where there is a risk of infectious diseases. Vicky, did you want to come in now? Really big hats off to you for what you and Nazim and others are doing, for role modeling through song and also dance.
Yeah, very happy to come in now. Unfortunately, Nazim had to leave because I think he was hoping to say something. But yeah, I think the main thing that we're trying very hard to do is to get away from the blame game and the negative messaging. And it is very much, again, I think as Holly was saying, it's about trying to build hope, give positive messages, and to get people to see that we're in this together. We're going to start working on a new song now, actually, because we've just finished doing the work with for the accountability breakfast with a fabulous animated video, which I'll make sure I put on the LinkedIn site. But I think one of the things we want to look at now is really what do we want the main messaging to be for the next song. I think one of the things you were just saying now, David, about not getting too close to each other. So we were trying to do an audit of the songs we've already done and look at where the gaps are. So if people have got some good ideas of what those key messages could be, please put them on the chat or in the LinkedIn group. And yeah, but I'm thinking something around the idea of not getting too close to each other, but doing it in a fun and positive way might be the way to do it. So maybe we need some dancing with people being very distant from each other as well. So anyway, send the ideas to us and then we'll incorporate them into it.
You know, we tried to shift the language from social distancing to physical distancing.
Exactly.
To imply you've got to stay socially incredibly connected.
Yeah.
At the same time being
so I like that concept then about being very sociable but being physically distant. So maybe that will be the theme. But again, if others have got ideas, please do pass them on to us.
Stay connected but keep your distance. That's absolutely super. Let's quickly go to Joe Nichols and family in because we're going to talk a bit about Somalia and Djibouti. Joe.
Yeah. So I'm working in Somalia and we're looking at the numbers there, and there's been still less than 4,000 cases and still only 99 deaths recorded. And it's been very, very flat for quite some time. And Somalia and Djibouti are showing very similar shaped epidemiological curves. Whereas Kenya and Ethiopia, the case numbers kept going up for a lot longer. And there's a lot of cross-border movement. Also, I mean, coming back to the comment Marianne made about Uganda, there are a lot of people that don't have very much space because there are 2.6 million displaced people inside Somalia. So they often live in really congested areas. And to begin with, the thinking from WHO and colleagues was that the numbers were low, partly because we missed cases and we hadn't spotted them. But the World Health Organization recently just did a whole load of outreach to do some fairly random tests in entire districts that hadn't been accessed before and hadn't reported cases, so-called silent districts. And they came back with only sort of 1% positivity rate. So even that was incredibly low. And comparing it also with the Somali population in Sweden, there were a lot of cases reported there. So it's not attributable, obviously, to any one particular fact. And perhaps it comes back to, like you're saying, you have to do everything. Perhaps there's a combination of factors that mean that the case numbers have stayed relatively low.
I think that's wonderful. To my friends from different African countries, many of whom are reporting similarly to what you just said, Joe, I just say be careful. This virus hasn't gone away. It can still come back and catch you. And so it slightly adds to the sort of sense of anxiety, I know, for many people. And also, the last thing we want to do is to stigmatize particular locations. But super important point you're saying, that there are these silent districts where, quite honestly, very little virus can be found. A bit like the Uganda story. Thank you, Joe, and thanks for sending so much to us. Lewis Thomas, where are you? Are you in the UK or are you somewhere else? Because you're going to talk a little bit about role modelling in hospital management within the UK. Over to you.
I am, thank you, David. So I'm based in London, the UK, and I work in our hospital management on our coronavirus testing strategy. And I found it really interesting because it really resonated with me how you're talking about the importance of clear communication and role modelling behaviour to get people to behave in the right ways to prevent coronavirus transmission. And I think one of the issues we've experienced in healthcare has been sometimes the messaging from the government has been changing or cause confusion among the populations throughout the course of the pandemic. So for us, whilst we've been able to control the communication within the healthcare setting and make that quite clear, we're at a point now where we're at a sort of similar level to infections during the first peak in the pandemic, but people are behaving in ways which are much more relaxed and as if we aren't facing the same sort of threat that we were before. So I suppose it's somewhat frustrating for someone working in hospitals knowing that people need to behave differently, but seeing that they aren't because of some of those miscommunications and misclarification in messages which have come from the government at different levels.
Very clear. Very clear. I think all of us find messy messaging a bit of a problem. NK Sethi is in New Delhi, and there I think, unless I'm really, really wrong, NK, you've had pretty consistent messaging, but if you've got any comment, that'd be great. Sally Smith has connected to many different community-based organizations around the world, and I know that you've got things that often when I ask you, you come in with good stuff. And Sally, I see you're on mute, but if you want to come in and do unmute yourself, NK, if you want to come in, do unmute yourself. I want to keep focusing on this role modeling because I'm absolutely determined on at least to try to get it right. NK, please.
Yeah, thank you, David. Well, very rightly you said, it's not a matter of choice between economy or public health. What I feel that we need to keep a local area-specific strategic balance between economy, COVID care, and non-COVID care. Yeah. I'll explain a little how it is interlinked. If there are more cases and deaths, productive man days are lost, which has a consequence on economy. Yeah. At the same time, if the health system is overwhelmed, it's not able to take care of either COVID cases or non-COVID cases, that too affects or decreases the productivity and adds on to the economic burden. So it's a vicious circle. And we need to keep a balance which maintains all these three in an appropriate position. And there cannot be a single silver bullet. It has to be area-specific, multi-sectoral, multi-stakeholder action which is locally relevant. So that is the point I'd like to emphasize. That's it.
Big challenge, of course, for really good and responsible governance. It can get quite difficult if you've got people playing around in those situations, but I'm seeing such brilliant examples from all over, not just India, but the whole Indian subcontinent, whilst at the same time, I know it's so difficult. I got some very troubling reports from Nepal just yesterday. Sally Smith, welcome to you. I don't know which part of the world you're in, but lovely to hear from you. Sally.
Thanks very much, David. Yeah, I'm in UK at the moment, and just wanted to say I heard a webinar this week that WHO EpiWin team did with Sri Lanka. They had people from the Ministry of Health, from the WHO, and some of the faith-based groups that have been responding to COVID and partnering on messaging. It was about role modelling from religious leaders in a trusted community where religious leaders are trusted. And just one statistic that they mentioned in passing really struck me, that they've been using WhatsApp messages, and through the national system of religious leaders, they had 41,000 WhatsApp messages going out on COVID per week. I just thought, just at a national level, that's really quite a big distribution list. So just to encourage people, we're working with WHO to strengthen the engagement with faith-based groups. There's a sign-up place on the website, and I can put the link in the chat. If anyone knows or is working with faith-based groups, please do encourage them to sign up and join in. Thanks.
Brilliant. That's lovely. It's that kind of amplification through networks that just excites me so much, because if you get out, you know, I'm not quite sure how many are actually in the WhatsApp groups that we were talking about in Sri Lanka, but you can do such a lot if you've got a WhatsApp group of 200 or 300, because any one of those can then become a node for taking messages a lot further. And those of us who've been just studying some of these very powerful amplifying networks are never endingly excited about the potential. Iman, you're in, I don't know which city you're in Canada. You've got a bit of a challenge. You're worried that the testing policy is going to make it much harder to know where the virus is. Iman, tell us what the concern is.
Hi, David and everyone, and thank you for this opportunity. I'm in Toronto, Ontario, in Canada, and we are definitely witnessing our second wave at the moment. The highest numbers are in Ontario and Quebec provinces in Canada. There were complaints about people having to wait for too long out in the cold, and the weather is getting colder. In Ontario, the policy was adjusted to making the testing by appointment only. While it's not that I don't trust my government. I have full trust that my government is trying to do the best with the best advice and trying to go on evidence base as well. So recently, number one, there has been advice from the Toronto Chief Public Health Officer to the government of Ontario to do some restrictions. It's not a full lockdown, but to ban indoor dining that has been reopened again recently, and to do more restrictions for Toronto. But that has not been responded to in a positive way. And so there is always dialogue back and forth between the health people and the policymakers. Now, my concern is regarding this testing by appointment only. We are aware that the capacity is limited. We know that, as you just confirmed, the numbers of tests available in Canada are limited. And we know that we are shipping samples out to California in the US. So with that said, and the policy changing to by appointment only, I'm not sure whether this will satisfy the demand. And our concern is that it will downplay the demand. I'm not saying downplay in a negative sense, but it will cap the numbers of tests being conducted, thereby capping the actual numbers being reflected in terms of the second wave. Would love to hear your reflections, please. Thank you, David.
Yeah, it's a hugely challenging issue. What do you do if you've got limited test capacity? This is really useful. I'm having conversations with some colleagues in Canada over the next 2 days. This will go into my back pocket. I will get back to you. Just watch this space. Thank you very much, Iman. There are many people here I'd love to invite to talk, but we're too late. What I would like to do is just invite John, if you don't mind, to just give any reflections. I'm going to go to Jack to tell us what's in his beautiful, beautiful thing, lovely colors. And then we will just do a quick close out. John, please.
Thank you, David. I'm struck in this conversation, as you might expect from me, about the elements of leadership that emerge. And I thought of 3 things listening to it that came through. One was, I think, as we were talking about this morning, the need for leaders at points of doubt or crisis to be visible and to be human, to be seen, accessible, and to recognize that they have doubts too, and not try and hold some supernatural plane. The next one is that in doing that, leadership is example. And in that respect, we're all doing it. It's not about great speeches and all of that sort of stuff. It's about doing the right things and being seen to be doing it. And if we do it, as various of you have said, in hospital settings, on public transport, when we go shopping, if we're doing the right things, then others start just doing it around us, and it's very potent. And the final one on the sort of 3 things I thought about leadership was your comments on fear, David, because courage is not the absence of fear. Courage is when we have that fear and when we're conscious of our anxiety, still continuing to do what is needed. And that, I think, is an important thing for us to remember. It's not wrong for us to be anxious about what's going on. And courage is not some great superhuman act again. It's just dealing with that and working out the things we need to do to carry on living our lives in a COVID-ready way.
John, it's an honor to be your colleague and to have the chance to learn from you all the time. I think all 3 of your points really hit home to me. Perhaps that one, leadership is how we are, not what we say or what position we have. And courage is not the absence of fear. It's living with that fear. Thank you so much. John also at another time reminds me about the importance of empathy and authenticity in leadership. And I think that is so helpful. Thank you. Thank you again. Jack, Would you like to just tell us what you've drawn?
Well, I mean, as always, I don't really feel like I'm qualified to add anything. I hope the drawing stands for itself. I'd just like to say thanks again for having us along to take part in these sessions. It's always a real treat, and it's always nice to get some sort of clear and pragmatic advice on what the situation is and how to move forward. So yeah, just like to say thanks for having us, and looking forward to the next one.
Thanks very much. Maurizio says it's not the testing that's the issue, it's what's done with the results. Very good point. We'll come back to that next one. Can I just invite Twee to give us our goodbyes, and then we will ring off.
Thank you, everyone. As usual, the recordings will go up onto our website, foresd.info, and our next session will be on Friday morning at 8:30 AM Central European Time. So I look forward to seeing some of you there.
And to everybody, those of you who've done it the first time, do let us know what you think, whether you find this useful. You can always influence it if you want to join future ones. Those who come quite regularly, our hearts go out to you. This is a big moment of appreciating you, because the issues we're discussing are so important for so many hundreds of millions of people. And we're tiny, but the fact that we keep meeting together and working together is super important. Bye-bye all. Special big hug to Zara.